Hi, this is Dr. Fodero. I'm a board-certified plastic surgeon, and today we're going to be talking about breast reduction. So I'm going to take you through a case. This is a very pleasant young woman who presents to my office complaining of several things. She has shoulder grooving from the bras that dig into the shoulder. She complains of some irritation underneath the breast in the inframammary fold, and she also complains of back pain, even though she's a young woman. She feels that this limits her activities, her ability to play sports and to be active. She doesn't like the appearance of the breasts, and she finds it difficult to find clothes that fit. She also just wishes that her breasts were smaller because she knows that having large breasts can make you look heavier than you really are. So what we did for her is we did a vertical breast reduction, which is a more contemporary type of breast reduction that's been done more recently in the United States. And what it involves is removing some breast tissue to make them smaller, but it also involves reshaping the remaining breast tissue and conservatively removing skin. And the advantages of this technique over the operation that was typically done in the United States is that the operation has less scars. The overall shape of the breast tends to be better than traditional breast reduction techniques. The longevity of the operation is better, meaning it lasts longer, and the recovery from the surgery itself is better. So let me take you through her surgery. So here she is before, and you can see the sag to the breast on this oblique view. And here's the other oblique view. So large breasts come with a little bit of sag, so we want to correct that as well. And you can see the size of the breast as well as the ptosis or sag. And here she is after the surgery, and the scars are limited to around the areola and down. And the benefit of this operation is there are no scars on the medial side of the breast. And so the traditional techniques in breast reduction involve putting a scar right here. And this scar, although it was traditionally done, was problematic because this is the area that's easy to see in a bathing suit. It's an area that can be exposed in certain types of clothing, and it's a scar that's difficult to fix later on. So if you can eliminate this medial scar from a breast reduction technique, that's a big advantage. The other advantages are that the shape of the breast tends to last longer and tend to be better. So here she is. You can see after her breast reduction that the breast has been lifted, and once again there are no visible scars here because there are no scars here. The scars are limited to around the areola and down. And once again on this side you can see that the breast has been reduced, it has been reshaped and lifted. And then from the side you can see that she has a very nice breast shape. The nipple areolar complex is now in an ideal position above the fold of the breast. She has good upper pole fullness, and the overall shape is more youthful and more balanced. And this is the other side. You can see that she has good overall breast shape. The nipple areolar complex is above the fold where it should be ideally, and this is in better balance with her body. So this is an operation where patients tend to be very happy. Probably has the highest patient satisfaction of really any plastic surgery operation that I know. And all the criteria have been met. All the things have been corrected. She doesn't have grooving from the bra strap anymore. She has no irritation below the breast because the breast has been lifted. Her back pain has gone away completely. She has no limitations to her activities. She likes the way her breasts look. She can find clothes that fit, especially bras and bathing suits. And the one thing that people say after is that people tell them that they look thinner, which is a nice bonus as well.